The patient is a 29-year-old male who was diagnosed with diabetes. The reason for his nutrition consult was his diagnosis of being a newly diagnosed diabetic and episodes of hyperglycemia. The patient was seen in urgent care and he presented with a blood glucose of 598. He stated that his symptoms of just like nervousness and sweating and just not feeling right overall presented over the past week. But over the last 2 months, the patient had increased stress in his life. He has a family member who's very ill and has been in the hospital, and he just had a new baby. The patient stated that his diet has been very poor. He frequently consumes Kool-Aid, soda, sweetened teas, and fried foods. He's often eating out. He also does not participate in any physical activity. He's currently unemployed due to the family matters that I have just discussed, and he lives with his new wife and baby. And the patient denies tobacco use and drinks alcohol on occasion. The patient was placed on a 75-gram carbohydrate diet. He has an independent feeding ability and no oral problems, no difficulty with chewing, swallowing, anything like that. The patient appeared to be in no acute distress. He was alert and oriented times 3. Lungs were clear. His abdomen was soft and non-distended, and bowel sounds were present. So as I said before, the patient was 29. He's a male. He is 73 inches tall and weighs 114 kilograms or 250.8 pounds. He classifies as class 1 obese with a BMI of 33.5. His ideal body weight would be 83.3 kilograms with an adjusted body weight of 91.05 kilograms. The patient's pertinent labs, just his blood glucose was high. That was the only lab that was abnormal. The second day that he was there, his blood glucose was 279. He has a past medical history of GERD, and his family history is significant for diabetes and hypertension. And just his one touches are important to point out. They were 240, 308, 396, 327, and 354, which are all high. The patient was placed on metformin and was on IV fluids and Zofran. The patient's Braden score is 23, no problems with his skin. So his estimated needs based on 20 calories per kilogram of his adjusted body weight would be 1,800 calories. This is also chosen just to help with some weight loss. His protein needs were 90, which is 1 gram per kilogram of his adjusted body weight. And fluid was 1,800 milliliters, 1 milliliter per kcal. So his diagnosis: food and nutrition related knowledge deficit, and this was related to a new onset of diabetes. Signs and symptoms was the consult. The patient needed diabetes education due to the fact that he was just diagnosed, and his A1C was 10.3. Another second diagnosis was obese class 1, and this is related to a sedentary lifestyle and poor food choices, and this is evidenced by his BMI of 33.25. So intervention: meals and snacks. The patient was to tolerate a 75-gram carbohydrate diet, which was ordered by his doctor, and nutrition education, which was huge. I spent about an hour with this patient and his wife discussing just his calories, his calorie needs just to help with weight loss, the diabetes education, just about spreading carbohydrates out, just making sure to keep carbs consistent. There was also education done by the diabetes educator about his medications and this patient was really receptive to learning. Him and his wife were very good, and you know, all of their questions were answered, which they had plenty, which was great. And they really seemed to adhere to the education that was given to them. Monitoring and evaluation indicators would be his blood glucose less than 200, his hemoglobin A1C, which we would like to get down below 7 within the next 3 months, which it may take a little bit longer than that, but it would be nice for him to get closer to 7, and a BMI closer to 25, which is of normal weight.